to how reform would be achieved, and there was no timeline as well. He changed his focus during that speech to jobs and the economy, but he did keep reiterating he's so committed to health care reform, and it's back in the hands of Congress. With the support for health care reform in shambles, the Democrats within the Senate and within the House can't agree on what package they actually want. President Obama, as Richard said, went to the Republican retreat on last Friday night, January 29th, in what turned out to be a sparring match. He complained that the Republicans had painted the Democratic health care bills as a Bolshevik plot. The president said that he would be willing to work with Republicans if they could find ways to compromise while embracing shared goals such as reducing insurance premiums. In my view, this is unlikely to work. So what are the Democratic options for passing health care reform? As I said, the House and Senate have passed lengthy bills. The Senate bill is over 2,000 pages. The House bill is almost 2,000 pages. And rest assured, I can guarantee that if any one of them has read any one of those bills, I'll eat this glass of water. Democratic advisors, last November 17th of 2008, just after the election, I was invited to a very exclusive meeting put on by the California Healthcare Foundation. It turned out that I was the only free market healthcare reformer there, but my 17 other compatriots were Jonathan Cohn from the New Republic, Mark Hoffman from the Huffington Post, Jacob Hacker from Yale, Julie Appleby from Kaiser Health News. It was just a complete group of people who were just dancing on the tables with the excitement that President Obama had been elected president and we were going to finally get health care reform. Jonathan Cohn, who I've debated several times, said to me at one of the breaks, "Sally, we've been in the wilderness for a few years, but you're now in the wilderness forever." I went back to my seat and thought, my life has come to an end. What am I going to do now? Well, Jonathan Cohn, Paul Krugman, Jacob Hacker, Harry Pollack, they have all encouraged the House to pass the Senate health care bill. So option one would be for the House to pass the Senate bill and to have the President sign it. At the same time, $300 billion in fixes that the House wants would go to the Senate for approval. These would include increasing subsidies for low-income Americans who are above the Medicaid limit, expanding funds to the states so that Medicaid for low-income people could be expanded, and then, of course, under this scenario, the Senate would only need 51 votes for reconciliation on the bill. That's option one. Option two, compromise and make the Senate bill make it much smaller. But you would only include things such as no denial of coverage based on pre-existing conditions, no caps on annual or lifetime insurance, expanding Medicaid and expanding subsidies, and as I say, no out-of-pocket caps on spending. Option three is from the very liberal wing of the Democratic Party, the senators and the House members. They want a very strong public option, that government-run insurance plan, which I believe will ultimately, if that happened, crowd out private insurance, and we would all be left in a Canadian-style Medicare for all healthcare systems. Option four, kill the bills and start again from scratch with using solutions such as are in several of the Republicans' plans. The President's desire for healthcare reform, as it stands now, in my view, is on life support. I wanted to point out, how does the President tell the American people that he will have this deficit-neutral $900 billion health care plan? If you If you listen to his speech, I was in Indianapolis on September 9th, watching the speech, and then I had to write an op-ed for the New York Post and get it in at 10 o'clock so it could be in the paper in the morning, and I was practically dead. But it was his 29th speech on healthcare reform. He said, in order to get a $900 billion plan, one way that we're going to cover this is to reduce fraud and abuse in Medicare and Medicaid by $450 billion. Now, it was interesting to me that the president didn't say that by expanding these programs, putting more people onto Medicaid and subsidies and things, was going to increase the fraud and abuse that is already there. After all, the federal budget that came out yesterday, he said now he's going to put $561 million into cutting out fraud and abuse in Medicare and Medicaid. If the government wants to do something, why don't they get rid of fraud and abuse before they start talk about taking over our healthcare? Another issue is Medicare Advantage, the private program for people on Medicare. The president wants to get rid of Medicare Advantage, and there are 10 million out of about 40 million seniors are on Medicare Advantage, the private alternative, and it's very, very popular. But he sees it as a costly program, and he wants to eliminate it. I think one of the more interesting points is that taxes, if this healthcare reform passed, the taxes would go into effect for us in 2010. But the benefits do not kick in under the House bill till 2013 and under the Senate bill till 2014. So if this does by chance become the law, I think the Republicans have a great chance to work on the bill after the 2012 election, assuming they can get control of the presidency, the House, and the Senate. This has been done before. For those of you who don't remember, Dan Rostenkowski was practically run out of Washington over his Medicare catastrophic bill. So, you know, the people are going to have to stand up. The Tea Party movement has to be stronger than ever. The town hall meetings. This can be reversed because the benefits won't have kicked in, if the American people will want to have the guts to stand up to it. I just wanted to spend a couple of minutes talking about the key differences between the House and the Senate bills. The House bill still has that public option, that government-run insurance plan. The Senate took it out when Harry Reid was trying to get those 60 votes. But it is the key demand of most Liberal Democrats, that public option. As I mentioned, Barney Frank, Howard Dean, they all want government-run health care. Under the House bill, 117 new bureaucracies would be set up. Talk about getting Washington under control. Why not create more bureaucracies? The House bill, and Nancy Pelosi is a huge supporter of this, has a tax on the wealthy of 5.4% on individuals earning $500,000 and on families earning $1 million or more, and an employer mandate for firms of 50 employees or more. The Senate bill, on the other hand, does not have the wealth tax, but they have what you've all heard about, the Cadillac tax, the 40% tax on Cadillac health care plans, which would be $8,900 for an individual and $24,000 for a family. The unions were up in arms. This started out at $8,000 and $21,000, and the unions negotiated, and now they've got it up to $8,900 and $24,000. Of course, Nancy Pelosi and her friends very much hate the idea of a Cadillac tax because it's going to hurt many of their union members. The House bill supports a national insurance exchange. The Senate bill has individual 50-state-run insurance exchanges. The House bill says it'll cover 36 million out of that 46.3 million Americans who do not have health insurance, who are uninsured. And the Senate bill says it will now cover 31 million of the 46. I just want you to know that in my book, one of the myths is I break down who are the 46.3 million Americans without health insurance. They may not have health insurance. It doesn't mean they don't get health care. 14 million of them are people who are eligible for government programs, Medicaid and S-CHIP, and haven't signed up. Why not? They haven't signed